Doo-doo-doo. Hi, how are you?
3-year-old Libby was born without thumbs. But now, for the first time, she'll be able to grip the handlebars of a tricycle. Pediatric Plastic Surgeon Dr. Cindy Verchere has rotated and shortened Libby's index fingers so that they can function like thumbs.
I think she's going to get a great result. Oh, look there. She's pinching it. Good girl. Well, when I tell people that I'm a plastic surgeon at Children's Hospital, a lot of people raise their eyebrows and say, don't you have ethical issues with doing plastic surgery on children?
But the plastic surgery done at BC Children's Hospital is very different from what you see on reality TV programs.
Yay, thank you. We do burns, we do a lot of lumps and bumps, giant moles, small moles, scar management. About 1/3 of my practice is cleft lip and cleft palate. I know, hi. Yeah, you too. It actually looks like it's come down a decent amount, actually. What you really want is you want this corner in here to look similar to that corner in there, where it's going to arch around a little bit more.
In the surgical suite, one of Dr. Verchere's most important tools is her bubble blower. 14-month-old Taya was born with a large mole covering her entire lower leg and foot. She's been coming down from Kelowna to gradually have that mole removed in patches. On this day, Dr. Verchere is using a certain technique for the first time, which begins with placing a pouch under the skin of Taya's unaffected leg. This pouch will slowly be inflated with saline over time so that the skin is stretched and can be transferred onto her other leg. Months later, during Taya's next surgery, Dr. Verchere takes out the pouch, removes a patch of the mole, and uses the excess skin to wrap around Taya's lower leg and foot. For the next few weeks, Taya will be bound in this position so that the extra skin can grow into place. Taya, like many of Dr. Verchere's patients, will need more appointments in the future, so Dr. Verchere works hard to establish a good relationship with them.
Did I put a sticker on my arm? Does that look pretty silly? Oh, I get another hug. Get another hug. Oh. The bus go round and round. The best physiotherapy is doing dishes, folding clothes, vacuuming, putting your stuff away, all those kind of things, like small everyday activities. Your mom should be here to hear me say that.
Pediatric plastic surgery isn't usually life-saving, but it is often life-changing when it helps children look like their peers. For example, 11-year-old Eric was born without a right ear. The surgical team took cartilage from his ribs to sculpt a new ear for him, which will be further sculpted and refined later on.
Are you happy that you had it done now?
Yes, I'm very happy.
Yeah. Do people notice your ear?
Yeah.
But this all looks great. It all is nice and soft and flat.
And today, Taya is back in for a checkup. Her extra skin has grown onto the patch where her mole once was, and her foot has been released from being bound to her other leg. She has more surgery ahead of her, but for now, her parents are happy with her progress. And they aren't the only ones who are happy. Dr. Verchere has a whole wall of thank yous from grateful patients.
I love it when kids make me stuff, but I don't think that it's an expectation of mine. Like, what I want is them to not even think about me, and I'd rather them just sort of be able to live the life that they were meant to live and do the things that they want to do without ever having to think about, oh, you know, this thing changed the way I thought about myself, or my ear, or my face, or whatever. You know what? I'm really proud of you. You didn't move your leg one little muscle. You did a good job. I know you were really scared. If you ask me what the best part of my job is, I'd have a hard time answering that. I can't imagine myself doing anything else. Okay? Bye-bye. Too slow. Thank God. Okay.